No, for too long, Black women have suffered disproportionately from rates of cancer and other diseases, and with very few exceptions are more likely to die of cancer than any other race or ethnic group.
Yeah, Black women have the highest death rate and shortest survival of any racial or ethnic group in the U.S. for most cancers. Well, now the American Cancer Society is trying to understand what's causing the disparity with a new study. Dr. Fola May is with the American Cancer Society, and she's here to talk about the Voices of Black Women project. Thank you so much for being with us.
Thank you.
Oh, my goodness, what an alarming statistic that we really don't have a why to, which I think is the frustrating part.
Exactly. First of all, thank you for having me back.
Of course,
I'm
we're glad to have you back.
Happy to be here and talk about this groundbreaking study that's being done by the American Cancer Society. You know, when we look at cancer, we have differences in cancer outcome by where you were born, what you look like, what race and ethnicity you are. And unfortunately for Black women, we are in one of the worst situations in that we actually have the lowest rates of most cancers, but we're most likely to die from cancer.
Wow.
And we have the lowest survival from cancer. So this study is really trying to understand why that is.
Absolutely. So you told me the study's already underway, but you need more people to join, and that's a big part of it, that Black women are underrepresented when it comes to cancer research.
Exactly. So the Voices of Black Women study is focusing on exactly that. We cannot answer those questions as to why Black women are more likely to die from cancer, have lower survival from cancer, unless we have Black women participate in research. And historically, participation from Black women has been very low in studies done by American Cancer Society and other organizations. So we're trying to change that. And we're trying to change that by having a study that's specifically focused on Black women. It's actually been led by Black women in the investigators and in the women who designed the study. And the goal here is really to understand how we live our lives, how we interact with the environment, with the healthcare system, with other people, with products that we use. And could there be links between those things and our poor cancer outcomes?
Yeah, it is all very interesting because I think people immediately think it's a lack of access to care. And I think one of the fascinating things about cancer research, and even we've seen it in maternal mortality research, is that Black women with higher incomes who would probably have better access to care still have worse outcomes.
Exactly. And most definitely it's multifactorial. It's not one thing that's causing these disparities. But the thing that I want to highlight is that it's not genetic. Because a lot of times I hear people say it must be genetics. There's maybe a small role of genetics, but it's more likely our social determinants, the way that we live our lives. And those are things we can modify. And that's why it's so important that we study those things and we come up with interventions to change them. This is going to improve the lives of ourselves, of the generations after us. And that's why it's so important that we participate.
Okay, great. So who is perfect to participate in the study? Who are you looking for?
Yes. So I'm really excited to share that most people will be eligible for this study. It's going to be people who identify as Black. You also have to identify as woman or female, between the age of 20 and 60, living in the United States, and you cannot have had a cancer diagnosis. So that's the large majority of Black women. You go to voices.cancer.org, and at that website, you can do a quick survey to see if you're eligible for the study. And the best part is that this is a really easy study to participate in. I'm part of this study. I joined a couple years ago. You just have to do a 30-minute survey twice a year, and that's it.
Wonderful. And then you can be part of this life-changing research that we hope, of course, leads to future changes.
Exactly, and you can change the lives of many women to come.
There you go. Dr. May, always doing such great work. We love having you on the show. Thanks for being with us. For more information on the Voices of Black Women study, we'll put the link you need on our website, cbsla.com/seen on TV.